Hello, my name is Nurse Pauline RN. Welcome to my channel. Today the title of this video is Fundamentals of Nursing Exam 7 RN NCLEX Review. Please like, share and subscribe. Today we'll start with sleep. Patient diagnosed with narcolepsy, intervention should be take brief 20-minute naps, no more than twice a day. Established regular exercise program. Teach patients side effects of sleep medications. Promote sleep for hospitalized patients. We will avoid waking patients for non-essential tasks. Teach use of antihistamines for sleep in the elderly patients. They are at risk for confusion, risk for falls. We're teaching patients the use of cover for sleep. This should not be used indefinitely. Cover may be toxic, may have toxic effects on the liver. Cover is not regulated by the U.S. Food and Drug Administration, FDA. Sleepwalking occurs during stage 4 non-REM sleep. When the nurse administers benzodiazepine for sleep to the elderly, priority assessment is bradycardia. Patient discharged with newborn. Patient discharged with newborn. Teach, place newborn on back to sleep. Patients with obstructive sleep apnea, you should elevate the head of bed and assume a side or prone position. Encourage evening exercises 1 hour before bedtime. Patients that you should delegate to your tech for sleeping. The techs will give patients back rubs. The techs will turn on quiet music, dimming lights in patients' rooms. Sleep hygienes are exercising before dinner, going to bed the same time every night, set your alarm to get up. Teach elderly to talk to healthcare provider before using over-the-counter sleep medication. Ways of improving sleep: avoid coffee before bedtime, turn off cell phone at bedtime, go to bed the same time every night, use soft music at night to relax, take pain medications 30 minutes before sleeping. We're talking about pain management now. Assess patient after opioid administration for difficulty arousing. Patients discharged with chronic pain. Nurse should anticipate medication orders for opioids. Anticipate the doctor ordering prescription for stool softeners to prevent constipation. Signs and symptoms of opioid withdrawal are shaking, chills, abdominal cramps, joint pains. Teach patient and family about PCA. Patient-controlled analgesia. Teach only the patient should push the button. The PCA system can set limits to prevent overdose. The most accurate resource for assessing pain is the patient's self-report of pain. When using ice for pain relief, apply is using firm pressure over skin. Apply ice for 5 minutes until numbness occurs. Use a slow, circular, steady massage. For pain, we're talking about TENS. TENS stands for transcutaneous electrical nerve stimulation. This is applied directly or near the site of pain. Multimodal analgesia plan includes, when caring for your patient with cancer, use analgesics such as NSAIDs along with opioids. NSAIDs along with opioids for your cancer patients. Use adjuncts such as Neurontin to manage neuropathic pain. For your cancer patient, we're going to be using Neurontin. We're going to be using NSAIDs along with opioids. We're talking about nutrition, laboratory values to assess the potential for wound healing is lipids. Your laboratory values you will monitor are your lipids. Patients with malnutrition with pneumonia risk are sepsis, pleural effusion, cardiac arrhythmias, malnutrition. Patients with dysphagia on a puree diet, when the patient starts choking while feeding, stop feeding immediately. Place patients on NPO, nothing by mouth. Patients who are on parenteral nutrition through a central line. If the patient has developed an air embolus, you should have the patient perform Valsalva maneuver for patients on parenteral nutrition with symptoms of air embolus. The purpose of fat embolism in parenteral nutrition is to prevent a deficiency in essential fatty acids. Fat embolism in parenteral nutrition will help control hyperglycemia during periods of stress. Parenteral nutrition will help wound healing. Delegation for PCTs. Delegation for your techs are your stable patients. These PCTs can perform your glucose testing. the PCTs can document oral intake. If your patient's glucose is elevated, check the medical record to see if there is a medication order for abnormal glucose level. Check to see if there is an insulin sliding scale for your patients with elevated glucose. When teaching elderly healthy nutrition, teach elderly to avoid grapefruit or grapefruit juice, which impairs drug absorption. Teach patients, the elderly, to take a MVI multivitamin, including vitamin D for bone health. Cheese, eggs are good sources of protein. Pay attention to your nutrition. You will need them in your NCLEX. We're talking about tube feeding. For tube feeding, you always fasten your tube to your patient's gown when ambulating them. You can ambulate your patients with the tube fastened to the gown while still infusing while you're ambulating your patient. You do not have to discontinue your tube feeding. Tube feeding patients, the head of bed, HOB, should be elevated 45 to 90 degrees while in bed or sitting in chair with the tube feeding, still infusing while they're sitting in the chair with the gown fastened to their, with the tube fastened to their gowns. To prevent central line infection in patients receiving total parenteral nutrition, clean the central line port through which the TPN is infusing with antiseptic. Patients with high risk for nutritional deficits are middle-aged patients, middle-aged female with celiac disease who does not follow a gluten-free diet. Patients with Crohn's disease who follows a strict diet but does not take vitamins or iron supplements are at high risk for nutritional deficits. We're moving on to urinary elimination. Patients scheduled to have an IVP, intravenous pyelogram, for CT scan implementation. Ask your patient, are you allergic to shellfish or iodine? Do you have an allergic reaction? If they do, notify the doctor immediately before they go for a IVP. For urinary elimination, first void of the morning, first void should be light pink, odorless urine of the day. If there's anything abnormal in the first void, there can be blood, there can be pus, there can be sediments, there can be foul smelling odor, there can be presence of blood. Notify your provider. When inserting an indwelling catheter into a male patient, advance the catheter to the bifurcation of the drainage balloon port. Urinary catheter removed. Patient need to void 8 minutes after removal of your Foley catheters. If they do not void in 8 hours, please notify the doctor. If patient voids within 8 hours, document in your eyes and O's exact time of urination. Document the amount, color, odor. Initial intervention for post-op patients with a 3-way indwelling urinary catheter. These patients are having continuous bladder irrigation. If your patient is complaining of lower abdominal pain and distension, your first assessment is to assess the intake and output from the system. First, you take a look at your intake and output. Make sure there are no kinking in the system. Elderly patient confused, unable to toilet self, but they are ambulatory. We are still gonna encourage these patients to ambulate with standby assistance. You will start a scheduling toileting program for this patient if they are ambulatory with standby assistant. Teach patient to prevent UTI, urinary tract infection. Keep bowels regular. Wear cotton underwear. Clean the perineum from front to back. Assessment of male patient with history of prostate enlargement, not emptying his bladder adequately. Assess if patient has dribbling urine constantly. These are for your patients with prostate enlargement, difficulty emptying bladder, patients dribbling urine constantly are your assessments for your male patients. Steps for inserting a Foley catheter. Please check your clinical procedure book. You're gonna be expected to know how to insert your Foley catheter. First, you drape patient with sterile, square fenestrated drape. Prepare sterile field and supplies. Lubricate catheter. Cleanse urethral meatus with antiseptic solution. Insert an advanced catheter. When urine appears, advanced catheter an additional 1 to 2 inches inflate catheter balloon. Gently pull catheter until resistance is felt. If your patient's catheter drainage bag has not been emptied for 4 hours, there are no urine from the bag. First assessment, you will assess the catheter and drainage tubing for occlusion. Make sure your tubes are not twisted. Intervention to implement when removing an indwelling urinary catheter. Allow the balloon to drain into the syringe by gravity. Initiate a voiding record. Document output. Measurement of post-void residual PVR is done by using a bladder scan, which is a doctor's order. Intervention to decrease the risk for catheter-associated urinary tract infection, otherwise known as CAUTI. CAUTI is intervention to decrease the risk for CAUTI. Intervention is hanging the drainage bag below the level of the bladder. Do not hang your Foley catheters on the rail of the bed. Do not hang your Foley catheters on the rail of the bed. You will hang your drainage bag below the level of the bladder on the frame of the bed. This is always a test question. If no urine when catheter is inserted 3 inches into the female urethra, you will leave that catheter in. You will go and get another Foley catheter. Have a second nurse assist you because the first catheter is left in after inserting it 3 inches and there's no urine. You will have another nurse assist you with inserting the second catheter. After you insert the second catheter and you have drainage of urine, then you will take out your first catheter. Nursing action to do after placing a bedpan under an immobile patient. After positioning the patient on the bedpan, elevate the head of bed 45 degrees. Signs and symptoms of bowel intestinal obstruction are not having a bowel movement, 2 to 4 days, constipation. Patient complain of nausea and vomiting, severe cramping throughout the abdomen and abdominal bloating. During an administration of a tap water enema, if patient complains of cramping in the abdomen, pain scale may be about 6 out of 10. Your priority intervention is to stop the installation. Teaching and instructing patients who are complaining of chronic constipation. Teaching includes increased fiber, increased fluids in diet, exercise 30 minutes a day, schedule time to use the toilet at the same time every day. Discharge teaching for patients with new colostomy are: you'll teach how to change the pouch, how to empty the pouch, how to open and close the pouch, how to determine if colostomy is healing appropriately. Normal stoma should be pink, beefy, red. Steps for an ostomy pouch change in the correct order. Please check your clinical procedure book. Steps for an ostomy pouch change: remove old pouch, cleanse and dry the peritoneal skin, assess the stoma and the skin around, measure the stoma, trace the correct measurement onto the back of the wafer. Causes of C. diff: Clostridium difficile infection, causes of C. diff are contact with C. diff bacteria. Members of the staff has poor hand hygiene, not wearing gloves from one room to the other, not changing gloves from one bed to the other. Another cause of C. diff is overuse of antibiotics. Signs and symptoms of bowel habit. Signs and symptoms of colorectal cancer are change in bowel habits, blood in stool, incomplete empty of the colon, unexplained abdominal pain. Teaching patients how to obtain a specimen for occult blood testing, blood in stool. They will collect the fecal smear from 3 separate areas of the bowel movement, not one area, 3 separate areas of one bowel movement. This is the correct way to obtain a specimen for fecal occult blood testing. Teaching family when a patient has fecal incontinence as a result of cognitive impairment to initiate bowel or habit training program to promote incontinence. Teaching family when a patient has fecal incontinence as a result of cognitive impairment is to initiate bowel or habit training program to promote continence. Assess patient for lactose intolerance, diarrhea, cramping after eating, foods that cause lactose intolerance, whole milk, ice cream, cheese. Most important intervention when caring for patients with ileostomy is selecting or cutting a pouch with an appropriate size stoma opening. Steps to administer a pre-packaged enema. Please check your clinical procedure book. Steps to administer a pre-packaged enema. Explain procedure to the patient. Perform hand hygiene. Apply clean gloves. Position patient left side. Insert enema tip after lubricating gently into the rectum. Squeeze contents into the rectum. Help patient to the bathroom when feel urge to defecate. When taking a health history of a newly admitted patient with diagnosis of fecal impaction, ask the patient if she or he has experienced frequent small liquid stools recently. For elderly complaining of severe weakness, diarrhea for several days, your initial assessment is for dehydration. Like, subscribe, and share. Have a good day. Stay blessed. Thank you.